The new year is almost here, and that could mean a new you. Plastic surgery is gaining in popularity right here in the Mid-State, and now you can see the results before you commit to surgery. Our Courtney Mooney joins us to show us how. Good morning, Courtney.
Good morning. I have Dr. John Stratis and Dr. Scott Gayner here with me. Now, you guys are just combining your practices now, and this is kind of a unique situation you have going here.
Absolutely. We're the first practice in the area, if not the state, that combines a facial plastic surgeon and a body plastic surgeon.
Okay, and it looks like you also have some interesting technology that you can use to show people the end result. What are we looking at here? We're
looking at your profile picture, and we have morphing or imaging software, and this allows us to simulate surgical procedures. Today, we're going to simulate a rhinoplasty or nose reshaping on yourself, and you can see that on the screen now, as well as putting in a very small chin implant and a little bit of liposuction under the chin.
Now, how realistic do you think are the results that this thing can show?
Very realistic. We intentionally image to what we believe we can attain surgically. It's very easy to over-image and give people unrealistic expectations, and when we're imaging, we intentionally try to do what we can actually do in the operating room.
Okay, so in layman's terms, what did he just do here?
He brought down a little bump on your nose and brought the tip of your nose a little bit closer to your face. He also gave you a little bit more chin augmentation or projection and removed a little bit of fat underneath the chin.
Okay, if only the actual surgery were that easy. I think I'll take
Absolutely.
That result.
Yes, I wish we could do it in 30 seconds as well.
Okay, now you had all kinds of things you could show us. You also had things you can do to the eyes on here, right?
Absolutely. We can simulate eyelid surgery. We can simulate filler response such as collagen and Restylane, and we can do all kinds of things on the body as well.
Okay, so this isn't just limited to face
Absolutely.
and effects there.
Absolutely.
Okay. Well, thank you very much for talking to us, and I know coming up we're also going to be talking about a few other procedures you can have done. For more information on everything we've discussed here, you can go to our web channel, that's WHPTV.com, click on featured links. You can get information on procedures and how to contact these doctors. Back to you.
Thank you, Courtney. Thank you, Shane. It's the fastest growing cosmetic procedure in the country. It promises to take years off your face. But what's it really like to get Botox? We should warn you, you will see an actual injection in this story. Our Courtney Mooney joins us to fill us in. Good morning, Courtney.
Good morning. I'm here with Dr. John Stratis and Dr. Scott Gayner, but in this situation, Dr. Stratis is actually going to be our patient. Now, we're actually going to do Botox here, right?
Yes.
Okay.
Botox is a purified protein that relaxes muscle short term, so we can get rid of wrinkles on the face that are caused by muscle contraction.
How popular are Botox treatments right now?
It is the single most popular plastic surgery procedure in the world.
Okay, well, let's get started. Let's see how this is done. Now, this needle looks a little bit scary.
Quite small, and you'll see Dr. Stratis' reaction, which won't be much. Go ahead and frown for me and relax.
Well, all you feel is a little pinch. It really doesn't hurt.
And you've been doing this. This isn't the first time, right?
No, actually, I've been doing this for 4 to 5 years, and it's very, very effective, and obviously I can get it anytime I want, but it's basically got no side effects for me. I really haven't any problems with it at all.
I mean, I know some people say it's like, drawing blood is a little pinch, and other people will say, well, that hurts. I mean, is this a comparable, or just to compare it to something?
Less so. The gauge needle we use is much smaller than that that we use for drawing blood, and we usually ice the areas before, so you really don't even feel that pinch.
So what happens now? Will he see an instant reaction, or does this take some time?
3 to 5 days before the Botox will relax the muscle fully.
Okay, and until then, there's no swelling or anything on the site?
And no restrictions.
Okay.
Right back to work. So it can be done over the lunch hour.
Okay. Are there certain people who are good candidates for this and certain people who are not, or?
Both men and women are excellent candidates. Okay. We usually wouldn't be doing Botox in somebody probably in their 70s, but 30s through 60s, absolutely everybody's a candidate.
Okay. Let's talk cost. I know you had a little vial there. Mm-hmm. Do you use that whole vial in a treatment?
We give Botox by the amount of units, okay. And most people charge by the amount of units given, much like when you go to the gas station and you're charged by the gallon. A Botox, a single area, if we just treated this area, the glabellar area in between the eyebrows, would use about 30 units and it'd be in the range of $400.
And that will last you how long?
Up to 6 months, typically 4 to 6 months.
Okay. Well, thank you very much, guys. I really appreciate it, and thank you for being our brave patient. And for more information on this procedure, you can go to our web channel. That's WHPTV.com. Click on featured links. There you can get information on how to contact these two doctors. Back to you.